Welcome to Raise the Line with Osmosis from Elsevier, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the pandemic and beyond.
Hi everybody, I'm Michael Curries, and today on Raise the Line, we're going to get the fascinating perspective of someone who has both experienced a life-threatening medical emergency and who treats people with life-threatening medical emergencies. Dr. Alin Gragossian is dually trained in critical care medicine and emergency medicine. In 2019, she underwent urgent heart transplant surgery after being diagnosed with acutely decompensated heart failure, secondary to dilated cardiomyopathy. Since then, she's been using her platform as a physician to talk to others, especially healthcare professionals, about her unique experiences as a young, critically ill cardiac patient, while also hoping to raise awareness about the importance of organ donation. She's also co-host of the Both Sides of the Stethoscope podcast with fellow heart transplant recipient and physician, Dr. Colby Salerno. And thanks so much for being with us today.
Thanks for having me.
It's quite a story, but before we get to that, we want to find out a little bit more about your background and what first got you interested in medicine and particularly critical care emergency medicine.
Sure. So my parents tell me, since I was a kid, I had always been really fascinated with medicine. I don't remember much of that, but I do remember when I was in high school, I started volunteering at an emergency department. So I'm originally from Glendale, California, here in LA. And I was just volunteering at a local emergency room, just a couple hours a week, wanting to go to a good college. And I ended up loving it. I actually ended up doing it for several years after that. And kind of, in all honesty, I had loved emergency medicine from the beginning. I remember watching one of my now mentors do a forehead laceration, and I thought that was the most amazing thing ever. And I was like, wow, what a life-saving thing you can do. So that's when I got interested, really liked it. Even in med school, I remember my own primary care doctor had told me to always have an open mind and not go into med school knowing what specialty I was going to go into. But the thing is, I ended up liking everything. I actually liked just a little bit of everything. And at the end, still stuck to emergency medicine. Once I was actually in residency, I realized the part about emergency medicine that I liked the most was kind of the resuscitation and the extremely critically ill patients, which is when I decided to go on and do a fellowship in critical care. So I love training, and it's been a great experience. And, I just got a different perspective of it once I became a patient.
So let's talk about your heart situation. Did you have heart issues? Were you aware of heart issues before this incident in 2019, or did that come as a surprise?
Actually, it was all kind of a surprise. So what happened to me was, this was my third year of emergency medicine residency. I had already applied and actually have gotten into fellowship at that point. So I just had a few months of residency left. As many people know, you apply to fellowship towards the middle of your last year of residency training. So that's kind of where I was at. And I had been feeling fine. I just remember while I was on the interview trail for fellowship, so this was October, November, December of 2018, I had this persistent, what I thought was a URI, some cough, and I didn't really think much of it. It wasn't keeping me from doing my daily activities, and it wasn't keeping me from traveling and going to work, but it was just something that was lingering. And so it just got worse towards around Christmas time of December 2018. And I found myself back in the emergency department as a patient, not as a resident. And that's when, everything kind of happened all at once. So we were trying to figure out exactly what was wrong with me, did some blood work, some chest x-ray, all that stuff. And then by then I had gotten admitted to get kind of a further workup to see what was going on. And I don't remember a lot of this, but I ended up having to get resuscitated pretty acutely, ended up in the ICU. I was intubated. By the time I woke up, maybe 24, 48 hours later, after doing all these tests, they found out that I had heart failure with an ejection fraction of 5%. So my heart was barely beating and functioning properly. And at that time, they were maybe it was a viral myocarditis. We were really unsure what had caused it, but eventually, after a couple of years of more tests, we found out it was a familial dilated cardiomyopathy that I had, probably triggered by some sort of external factor. like a virus, but there's so many factors that go into these things. So it was all
Sure.
sudden, but they do think that maybe I had this predisposition that I just like compensated very well for my whole life.
Yeah. So you wake up after that, you're in the ICU, and then you find out you need a new heart?
That is almost literally what happened. So they had diagnosed me. This was at the hospital that I had been doing my residency at. Eventually, they transferred me to Penn. And, Penn in that area was very well known for their advanced heart failure therapies. And I remember even them saying something like, well, we're going to have to transfer you to another hospital with advanced heart failure therapies. And I was like, what does that even mean? Like, I had been an ER doctor going into critical care, but I couldn't like fathom. I was like, no, I probably just need a little bit of medication for a couple of weeks. It's probably just a thing that's going to go away on its own. And no, by the time I got to Penn, they were like, no, you need a transplant. And so I always tell people that from the time of my diagnosis up until the time I was transplanted and left hospital was about 3 weeks. So like
Oh
I went
my
from a
goodness.
completely normal, like 30-year-old to somebody with a heart transplant. It was crazy.
That's unbelievable.
Yeah, yeah.
That's so fast. So I think people know that there's long, long wait lists for kidneys, but I guess they're shorter for hearts, huh?
No, actually, it's pretty long. The thing that you have to take into consideration when somebody is on the organ transplant waiting list is how sick they are. So the sicker you are, especially with just one type of organ failure, which is generally like the younger people who have been otherwise healthy their whole lives, are going to be on the waiting list for a less period of time. Blood type also matters, like body size also. It's a lot of things that go into it. But and kidneys are a little bit different because you can be on dialysis for a long time as well.
Sure.
Whereas with hearts, it's a little more acute for some people. So there's a few things that go into it. Generally speaking, not everybody is able to get a transplant within weeks, but depending on how sick you are higher up on the list.
Yeah. Just amazing to think how quickly you end up, having this completely different life, really.
I know. Yeah. Yeah.
So what was it like in the early stages post-transplant?
Early stages. So I remember there's a few things that have to go into the answer of this question. So number one was that like everything happened very suddenly. So I had been pretty healthy, athletic, eating well, otherwise right before I got sick. And I think that helps with the recovery process. So like as quickly as I got sick, my recovery was pretty good and, knock on wood, wasn't that bad. Of course I had some issues. Like I think I had rejection early on, which is pretty common early on post-transplant. And, there's medication side effects that you have to get used to. So a lot of the medications that you're on are very strong and mess up the lining of your stomach. So you have like GERD and nausea and all these different things. It was just a matter of me kind of learning that this was my new normal. So I tell my own patients that, and I would even before all this, like once you have something critical happen to you, you're probably never going to go back to who you were before that. You can get pretty close, but like my expectations were like, okay, like I'm probably never going to be who I was in November of 2018, but I'm going to try to get as close to that as possible. And if I can't, at least I know that I tried. And so there were some side effects of the medications that I had to kind of get used to. And of course, the beginning of starting to take these meds is a lot more difficult than, once you've been on them for a while. And then, there's all these like little things that you have to go to the doctor all the time, get all these caths and all that stuff. But overall, considering that the other thing that could have happened to me was the fact that I could have died, like all of that was nothing compared to what could have been. So.
Yeah, you get some perspective on life for sure.
Right. Yeah.
So you're several years out from the transplant at this point. Can you kind of recap how things have gone and what's your quality of life like right now?
Yeah. I'm actually next week is going to be my 4th heart anniversary, is what we call it. So, it's been an incredible 4 years. I've had some ups, some downs, but overall, I don't think I can complain. Like, I've had one of the major things that I had to go through after my transplant transplant was a lot of joint issues, which was common with the steroids. So I actually had to get my hips replaced.
Oh gosh.
And like, but the thing is, like, once you've had a heart replacement, like
Everything else is easy peasy, right? No big deal.
So like the perspective that I had with these little issues and things like that was very interesting. Quality of life overall is better than expected. Like there's a lot of people who assume that once you get a transplant, you're going to be debilitated and bedbound for the rest of your life. And that's not true. I actually went back and finished my training. I actually even went on to do my critical care fellowship. I do have to take a lot of precautions, but it's again, it's something that I just had to learn how to get used to more than anything. And it's been an interesting few years. I have learned how to prioritize things better. So like, whereas 4 years ago, 5 years ago, I would have been like, I want to work like 80 hours a week and I'm going to do this and I'm going to make this much money. Now I'm kind of like, yeah, I just kind of want to enjoy life here and there and take time with spending time with my family. And priorities changed to an extent. I still have very similar goals. And I kind of take every day by the moment and do what I can with every day.
So I want to tap into those perspective changes a bit, and the first category being what I mentioned at the top of the show, which is you're trying to communicate to your fellow healthcare professionals some of the lessons that you learned from the patient side of things and how maybe they can change how they deal with critically ill patients or any kind of patient. So give us some of that wisdom, hard-won wisdom.
I think there's a lot of things that I learned from becoming a patient. And a lot of it just has to do with like, I don't think it makes me a better doctor. People say that all day, like, oh, you're probably such a good doctor because of what you went through. And like, no, because I don't think that you have to go through like a cardiac arrest or something crazy to actually be able to empathize with your patients. But I do think that it gives you this extra kind of sense of what's going on. And I'm able to empathize with specific things, specifically like patients in the ICU, younger patients going through cardiogenic shock, patients who are going through transplant. There's like there's a set of people that I probably empathize with more than others. But at the same time, I've had a lot of, amazing lessons from what I call patient school that, medical school never really taught me. So even like the little things like what it's like dealing with insurance authorizations. Like the reason why I went into emergency medicine is because I hated dealing with insurance companies and billing and stuff. And I kind of just wanted to take care of what I can in front of me. And like here I am now as a patient, like dealing with insurance companies all the time. so it just gives me like this extra perspective that many doctors also have, but not everybody has. And the fact that I share it also helps some people. I don't tell every patient, but there are some patients that I tell my story to. And I think that just gives us a different kind of relationship.
Yeah. Well, I can imagine, particularly somebody with heart issues that's young.
Right. Yeah.
It must be just amazing to see you there practicing as a physician and knowing that it could be okay,
Exactly. Yeah.
What else do you think health professionals miss out on that you experienced on your way through this amazing journey?
It's hard for me to pinpoint exactly. There's just some things that I even the basic things, like I know exactly what it's like to get a cath. I know exactly how important like a blanket is, like when you're in the hospital. Those little things. I'm very careful with ordering blood tests because like I became anemic from how much blood they were, getting from me when I was in the hospital, and that was annoying. I've needed blood transfusions in the past, so there's like little things that I changed my management about, but overall, it's just this sense of knowing a few of these minute details that not everybody would know, even if they have been working in a hospital for a long time. But I'm very open about it. So I do tell my co-fellows and colleagues like to ask me if they ever have any questions. Like, what is it like getting a chest tube? What is it like getting central lined? Just ask me, I can tell you. So
from a really broad perspective, is there anything that you would change about medical education from a curriculum standpoint that would help with this?
I do think that I don't think we did this in med school. So this would be something interesting to look into. But having like an actual patient come and talk to medical students once in a while about their experiences and how they're able to deal with things would give us a very different perspective that we're not used to. Like, it's not there's only so much that science could teach us, right? Like I remember one thing that, we always read about the being in the ICU, in the ICU literature, is how quickly you should get people off sedation. Even when they're on the ventilator, you have to get their breathing tube out as soon as possible. And there's so much that the science tells us about how sedation is bad. But once you've been in the patient's shoes and you've seen like how uncomfortable that tube really is, like, I totally agree that tubes need to come out as soon as possible and you shouldn't be sedated for a long time. But there's this new like humanizing side to medicine that I see, that I feel like I can also educate others about. So I think it would be nice to incorporate more patients into a medical school curriculum for sure.
Or grand rounds, maybe.
Yeah, right. And I do plenty of those. And it's interesting because I kind of feel like a weird connection, because like doctors are always like, oh my God, my own doctors would be like, okay, you're a doctor too. And then other patients would be like, okay, but you're also a doctor patient. So do you see things differently than me? So I do have a very specific perspective that I think maybe others could benefit from. And whether it's me or other patients doing grand rounds, it would be a great way to educate others.
Yeah. So the other, perspective you've gained from this is appreciating organ donation, I'm assuming. And what is your message about that? And particularly, I'm interested in what you think, if anything, can increase the participation in the United States. There are other countries where they have an opt-out system. It's assumed you're going to be an organ donor unless you indicate otherwise. Here, it's a much different situation. And our donation rates, although they've increased quite a bit in the last 10 years, it's still behind other countries. So what do you think would help?
I think educating others, even with simple stories like mine. I talk about my organ donor a lot. I know her family very well. Her name was Lucy, and she unexpectedly died. She was only 23, and she was actually a respiratory therapy student. So she, her mom loves telling her story because Lucy's life goal was always to, help save lives. And she did. She was 23 when she died, but she was able to go on and save 4 of us. So it was me, 2 kidney transplant recipients, and then 1 liver recipient. And so just by telling my story, I've had people say, like, I wasn't an organ donor until I heard your story. And I think that in itself, being very open about what organ donation can do, telling these humanizing stories, and being able to teach people. There are a lot of myths around organ donation. So I feel like once you're able to bust those myths, then it also makes it easier. And so I think with time, especially now with social media and a lot more people being open about their chronic illnesses and transplants in general, hopefully we get more organ donors to become registered.
Absolutely. And I'm going to put a plug in here for organ donation. It's very simple, quick. You can go to donatelife.org and find out how to do it. And, something that some people don't realize is you can pick and choose what you want to donate.
Right, exactly.
Maybe you're not comfortable donating your eyes or so forth, but it's really simple. And then you're on a registry that providers nationally can tap into. And so when you get to the unfortunate situation, maybe where you're in an emergency room in a trauma situation, your wallet's not necessarily going to be there with you.
Right.
And your family members might not
know.
So
right.
Yeah, it's a great thing to do and very simple to do. So, all right. PSA is over about that. So tell me a little bit about your podcast. And I'm sort of amazed that you have found another physician who's also a heart transplant recipient.
There's actually plenty of us. Like once I started my opening up about my journey and telling people about everything that I was doing and everything that I had gone through, I want to say by now, I think there's like 40 or 50 physicians that I've met with transplants. Not everybody's open about it, but there are plenty. Wow. And Kobe was one of the first. So he was the one who had messaged me on Twitter way back, maybe a couple months after my transplant. And he was kind of like, I'm an internal medicine resident in New England, and I have a heart transplant. His story's a little bit different. So he had heart issues when he was a kid and then ended up getting transplanted before med school. So it kind of like paved his career. He's now a cardiology fellow. And it really like inspired him to go to med school. Whereas for me, it's similar but different in that I also have a genetic mutation, but it was all sudden after my training. And
Right.
so we have very similar backgrounds, but different in that, there's some things that he's gone through that I haven't, and vice versa. So he had messaged me and he said something like, yeah, I'm an internal medicine resident and, I have a heart transplant. If you ever have any questions, just let me know. And it's always nice. Like, I think one thing that we need to fix about this healthcare system is making sure that our own patients have good support groups. And with our generation, like, social media is just as good, if not better, than like in-person meetups most of the time. So even having like a support group on social media, whether it's Twitter, Facebook, Instagram, whatever it is, it's just so nice to know that there's others out there that you can talk to. It's not just your doctor. And so Kobe became that person for me. And so years ago, he had said, like, we should make this podcast. And it was busy. We were busy because we were both fellows. Like, I was a critical care fellow and he's cardiology, and like, if there's two fellows that are like never at home, it's just
Those scheduling problems must be pretty big.
So we started, and now we're about to start our next season in a couple months. So we're just kind of brainstorming, but it's been really fun. And we give different perspectives on like what we try not to give medical advice, of course, but like just kind of things that we've been through as doctor patients, and then like kind of like our takes on vaccines and how important it is for transplant patients and things like that. So it's been really, really nice.
Yeah, that's great. I'll have to check it out.
Yeah.
Both sides of the stethoscope.
Mm-hmm.
So, as you may know, Osmosis is a teaching company, and we love to fill knowledge gaps. So is there something that's, particularly important to you beyond what you've spoken about already that you wish people knew? They don't know. And you would say, hey, Osmosis, can you make a video about that or something?
I actually think there's not a lot of training about organ donation when it comes to medical education. And so if there's one thing that I like to hound on any interview that I do, no matter what, I like, one takeaway point for me is to always remember that each organ donor can save 8 lives and improve the lives of up to 75 others. Because it's not just the major organs that are procured; it's also tendons, corneas, tissues, things like that. So
skin.
Yes, exactly. And so there's people. There's even doctors who don't know that, and when I tell them, they're like, "Wow, that's amazing." So that is one educational point that I like to tell people for sure. So I would say that.
That's a great idea. So we always like to wrap up getting some advice from our guests for the learners in med school, nursing school, and so forth, and also the early career professionals who are in our listening audience about approaching a career in healthcare. What's your bottom line? I
think there's a lot of times in medicine where something might happen to you and you feel like you might be burning out, or you feel like there's just too much going on. And I think it's okay to remember that at the end of the day, what you do really matters. And I say that with the intention of letting others know that like what happened to me is kind of what I was hoping would happen to my own patients, right? Like I was so suddenly ill, but I got resuscitated and I got better, and I have this, good quality of life that I was able to go back to. And so anytime you feel like you're not really helping, just remember that there are patients that you truly are helping, even when you don't feel like that. And I tell my own doctors all the time. I even remember going to the first cardiologist who did my cath when I was acutely ill, and I told him something like, hey, thanks a lot. And he was like, that really means a lot to me. We don't really get this, and I don't usually see this. And it really it stuck with me till this day, because we don't always feel appreciated, and we don't always see how important it is to be in healthcare. So that would be my point to others.
Yeah, that's a great thing for folks to keep in mind, because there are a lot of long, tough days.
Yeah.
In this profession. Well, listen, we'll have to leave it there, but I want to thank you so much for joining us and sharing your story, and wish you the best as you move along here in your healthcare career.
Thank you so much. Nice meeting you.
You too. I'm Michael Carisse. Thanks for checking out the show today, everybody. And remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisetheline podcast.